Okay, so what is the proven strategy that always gets me a meeting with a PI attorney after a legal networking event? And again, this is something that should not be overcomplicated. I think it just comes from experience and getting the reps in and really understanding the value you bring as a doctor to those personal injury patients. So the one sentence that I always throw in when I'm meeting somebody for the first time, especially those personal injury attorneys or the staff actually of the personal injury attorneys who are going to be crucial in possibly referring new PI patients into your office, is we understand how to case manage and case build when it comes to PI cases, okay? And implicit in those two words means that we understand when it comes to case management that that's going to entail quality communication with the patients, with the actual other healthcare providers, if there's other medical docs or specialists involved in that case. And most importantly, in many cases, at least for that attorney, right, is going to be the quality communication that goes back and forth between you, your team, and then the legal part of that case, that legal team. You know, are the patients compliant? Is there any malingering? What exactly are the treatment recommendations? Did the patient make the MRI, etc.? And all that little nuance there is involved in case management. Now, when it comes to case building, again, what that means to them is that you are going to do everything you can to not only help the person get better, right? I mean, that's a no-brainer. You want to treat your patients right, but it's important to do it in a way that it's documented properly, that you haven't taken shortcuts, and that you understand what needs to be in the documentation, that you're telling that patient's injury story accurately, and you are, again, communicating properly with all of the healthcare providers on that case, utilizing and have those healthcare resources at your disposal when they need in order to send that patient out for the proper diagnostic testing. It's going to be crucial with personal injury that the pain generators are actually proven, that you can show what the pathology is and how it's related to that specific auto accident, that your notes, that your referrals, that the other healthcare providers that you're working with can actually back that up as well. And especially in those cases where you have those non-disc ligament injuries and other pathology that you may see for a long period of time, you don't want there to be an issue there. The attorneys know this. And again, this one key phrase, we understand how to case manage and case build when it comes to PI cases, has been extremely helpful. Clearly, there's some other nuance there you want to throw in. You understand depositions, you have experience, things like that. But just the case management, the case building part will really help you nail down a meeting with a personal injury attorney. Because, I mean, let's be frank, there's business owners as well. They want to know that first and foremost that their clients are getting treated properly, but they want to know that their clients are getting treated properly by doctors, by chiropractors, by any other healthcare specialty who know what they're doing, not only diagnostically, but when it comes to working with the healthcare team, documenting all that properly, packaging that, putting that together, and making sure that when you send that final over to that attorney representing that client, that they have everything they need, they have all the ammo they need to really make sure that that case value is there. So hope this really cleared up some of the nuance and some of the confusion sometimes around getting in front of attorneys. Again, medical networking events, lots of fun. You'll meet great people, and just make sure when you're there and you're rapport building at some point that you mention that you understand how to case build, case manage when it comes to personal injury, and that will get me a one-on-one and should get you a one-on-one as a quality provider in your area with any PI attorney. So Dr. Calarco here. If you want to learn more about anything PI related, go ahead and check us out at PIExpertsecrets.com. Thank you for your time.